Welcome to Verified RX, your prescription for success. Brought to you by the Vizient Center for Pharmacy Practice Excellence.
Hello, and welcome to Verified RX. Today we explore the Vizient Winter 2026 Spend Management Outlook, specifically diving into pharmacy projections and what's changed this time around. We'll also cover ambulatory care and self-administered drugs, biosimilar therapeutic insights, and dynamic pharmacy market forces. Joining us in this conversation are my Vizient colleagues, Dr. Jeni Hayes, Senior Clinical Manager, Strategic Clinical Intelligence, and Dr. Heather Pace, Senior Clinical Manager, Ambulatory Care. I'm Carolyn Liptak, Pharmacy Executive Director at Vizient Center for Pharmacy Practice Excellence, and your program host. Welcome to the podcast, Jeni and Heather. It's great to have you back.
Thanks so much, Carolyn.
Thank you, Carolyn.
Jeni, let's start with you. For our listeners who don't live in this data every day, what is the Spend Management Outlook and what's the headline for pharmacy?
The Spend Management Outlook is our biannual publication where Vizient projects healthcare prices across the major categories of healthcare spend. So this looks like pharmacy, physician preference items, lab, med-surg, capital equipment, and indirect spend. For pharmacy, the headline here is that our overall inflation is slightly lower than the last edition, but spend is really a major focus for leaders because it is driven by increased utilization and new technologies entering the market.
Thanks, Jeni. One important question that we always ask when the SMO is released is, what's the top line outlook for drug inflation over the next 12 months?
Without further ado, the projection for purchases between July 2026 and June 2027 is 2.84%. This is slightly lower than last summer, which was 3.35%. And it's important to note that this projection is based on wholesaler purchase data from the period of October 2024 through September 2025. And it's weighted. The drugs with the greatest amount of spend are going to have the biggest influence on our overall inflation number. One other note is that there is a difference between contract status. So medications that are on Vizient contracts tend to have a lower inflation rate, while non-contract products still make up about 70% of our member spend. Knowing the inflation numbers for those medications is really important for budgeting.
That makes a lot of sense. We do know that there's differences between acute care and ambulatory. Jeni, can you break that down by site of care?
Sure. We rolled out this segment of the market analysis last January, and it's been helpful to help align with how health system leaders manage their strategy in the different divisions of pharmacy. For this edition, our acute care projection is 3.03%. Spend in the acute care environment is still heavily driven by agents like Sugammadex, Kcentra, and other clotting factors. In the ambulatory section, we see a slightly lower projection overall at 2.85%. But there's really a divergence here. Provider-administered therapies, think of injections or infusions that are given in hospital outpatient departments and physician offices. The inflation for these provider-administered therapies is 3.35%. On the other hand, our self-administered therapies, think about retail, take-home medications such as specialty biologics, and our oral therapies is much lower at 2.43%. We do see a significant difference between the various segments of the market within the pharmacy world, whether that's between acute in our hospital outpatient clinics or through our retail and specialty pharmacies.
So, Jeni, can you be a little more specific? In the provider-administered drugs, what's moved the most and what does that signal?
Our provider-administered section is driven by a lot of oncology infusions. Again, those that are purchased through wholesaler channels. Specifically, the top agents we're looking at are Keytruda and Darzalex Faspro. Both of these are continuing to receive new indications and are increasing in utilization throughout our outpatient departments. We see this huge shift in the provider-administered space for oncology infusion therapies. In the inpatient space, oncology has an interesting split here. Oncology spend is driven by our CAR-T agents. Think Carvykti, Breyanzi, and Yescarta, with very high acquisition costs. In the outpatient space, we have a mix of therapies like Keytruda and Darzalex given in the infusion setting. And now we're also seeing things like bispecific therapies and even some of our new cellular therapies being moved into the outpatient space. There's a lot of opportunity for growth and ways to be strategic about what site of care we're providing these oncology services in.
Jeni, you talked about acute care and ambulatory care, but what about self-administered medications? What's moving this category?
In self-administered medications, there's 5 drugs that seem to be pushing the needle forward. 3 of those are for autoimmune and inflammatory diseases. Specifically, we're looking at Skyrizi, Dupixent, and Rinvoq. And then we have therapies for diabetes, endocrine, and weight loss now, including Ozempic or Wegovy, as well as Mounjaro or Zepbound. So there's a huge amount of commercials and other media, and there's increased indications and increased utilization of these medications. This is a really great opportunity for pharmacy leaders to be strategic in how they manage their retail and specialty pharmacy programs to try to provide exceptional patient care while also capturing margin opportunities for these therapies. The takeaway for the self-administered medications is less about the inflation projection and more about utilization optimization. Even when the inflation projection is lower, spend is still rising, specifically in the autoimmune and the endocrine metabolic therapy areas. There's a great opportunity for specialty pharmacy support, including benefits investigation, patient counseling and adherence, and other strategies to optimize the care of these patients through our health system pharmacies.
Sure, that makes sense. Before we get to overall key takeaways for the Winter SMO, it does call out dynamic pharmacy market forces for 2026 through 2030. What should pharmacy leaders keep on their radar?
Yes, this is a new section that we've added to the SMO for this edition, and we're excited to lay out some practical ways that pharmacy leaders can plan throughout their budget year. Our 7 dynamic pharmacy market forces are listed in no particular order, but really tie into high-impact drugs and various strategies. I encourage you to click the link in the show notes to get to our publication and really see which medications these apply to. The 7 market forces, in no particular order, include growth in specialty and cell and gene therapies. This should not be surprising, as cellular therapies such as CAR T and gene therapies are quickly expanding in many of our areas. They require visibility into your direct purchase patterns and how reimbursement is being optimized through your organization. The second one, tied to cell and gene therapies, is expansion of value and outcomes-based contracting. So we're starting to move away from the fixed DRG reimbursement system into possibly single case agreements for these more expensive therapies. Third is site of care shifts towards ambulatory and home. We're trying to keep the sickest patients in the hospital and move other patients into hospital outpatient departments, provider offices, infusion suites, and even into their home to optimize care. Fourth is digital transformation and automation. There are so many awesome opportunities to use analytics and automations around workflow to improve efficiency, increase safety, and reduce waste. Fifth is supply assurance and resilience. We have all struggled with drug shortages in our careers as hospital pharmacists. The commitment to continuing to optimize how we manage and respond to drug shortages, especially for essential injectable generics, and really trying to add resilience back into our supply chain. Sixth is the expansion of pharmacists' clinical scope and different workforce models as we continue to optimize care for these patients, as we continue to see new strategic opportunities in specialty pharmacy, in cell and gene therapies, and really ways for pharmacists to work at the top of their license, providing exceptional patient care. And then finally, there are a lot of regulatory and policy efforts underway to attempt to lower drug prices, including updates to the 340B program, the IRA implementation of the Medicare Part D price negotiation program just this January. There's a lot of moving targets for pharmacy leaders to be aware of. We wanted to provide this framework so that when leaders ask, what should I plan for? You have an overall high-level view of the major strategic drivers that are influencing pharmacy practice.
Thanks for that summary. It's super helpful. For those pharmacy leaders who are listening, what do you want them to do with this information?
I have 3 practical takeaways based on all of this information I just shared. First, you can use the 2.84% inflation projection as a baseline, but we really encourage you to customize that. Within Vizient Pharmacy Analytics, use the drug budget forecast to match your institution's spend to the actual line item inflation, so you can generate a projection that reflects your actual drug mix. Second, we're really excited about these segmented views, looking at the different trends in the ambulatory space between provider-administered and self-administered, which are quite different from the things that are going on in the acute care market. And this can help you really figure out where to focus operational effort and optimize cost, margin, and reimbursement. And then finally, identify your top moving medications and connect them to these longer term market forces. Does this look like opening a retail specialty pharmacy if you don't already have one in your health system? How are you optimizing the site of care for provider administered drugs?
Heather, let's start with the biosimilars therapeutics insights. What were the most important themes we saw in the biosimilar market over the past year?
In 2025, what we saw was a shift from the approval of biosimilars and the therapeutic insights focused on the adoption of biosimilars. And Stelara or ustekinumab biosimilars were the clearest example that were highlighted in the therapeutic insights page. With ustekinumab, multiple biosimilars were approved with no meaningful clinical differentiation. And uptake of those biosimilars was driven almost entirely by payer and PBM strategy. In the biosimilar utilization graph, utilization showed high variability with really no uniform curve across any market. The utilization illustrated depended on formulary design, preferred products, and benefit alignment. The message that was highlighted in the therapeutic insights was that biosimilars are no longer just approved or available, but they are being actively managed and steered by payers.
Heather, you mentioned Stelara specifically. Why did that product become such a defining example?
With Stelara, we saw the PBMs develop private label biosimilars, and that played a central role in adoption. Formulary preference outweighed brand familiarity, and early volume concentrated around the PBM-affiliated private labels. Net cost, contracting, and copay design mattered more than any interchangeability status or manufacturer differentiation. This does set expectations for what we may see for future high-cost biologics and how they may roll out.
So based on what you've just said, what does this mean for health systems trying to manage biosimilars operationally?
Health systems should expect payer-specific product preferences, and it makes it difficult to standardize formularies. Switching is becoming routine rather than episodic, and operational considerations were highlighted in the therapeutic insights include site of care implications that may be required by payers, product presentation and supply chain logistics, as well as billing and reimbursement nuances. Maintaining at least one formulary alternative may still be necessary. The challenge is less clinical anymore and clinical decision-making and more related to workflow flexibility.
Building on what we saw outlined in the therapeutic insights, how does that experience shape what we should expect from biosimilars in 2026?
We're going to see an increase in speed of adoption. There's going to be less lag time between approval and formulary actions, earlier switching expectations from payers, and fewer preferred products despite many approvals. There may be fewer trial periods with the reference products of the biosimilars. Biosimilars are becoming more of an assumption and rather than if, how fast and how broadly will they be adopted.
So speaking of adoption and looking ahead into 2026, which biosimilar launches do you think will have the biggest impact based on what we've already learned?
EYLEA had multiple biosimilars approved in 2025, but many are still pending litigation outcomes. There is one that was launched at risk, but it is anticipated that many of the others will be launched in 2026. EYLEA is a high-budget impact drug in ophthalmology and falls under the medical benefit, where buy-and-bill dynamics will make payer strategy especially influential. We also saw the first biosimilar of Xolair be approved in 2025, with additionals anticipated and launch in late 2026. This does expand biosimilars into the allergy asthma category and potentially expanding reach of biosimilars into retail specialty channels. This represents a new practice setting for biosimilars. And lastly, for 2026, Perjeta. The first biosimilar is expected late 26, early 27, and this is a high-cost oncology biologic. The release of the Perjeta biosimilar will test how quickly oncology pathways will adapt to biosimilar competition, as it is included in many oncology regimens and not a standalone.
So Heather, in addition to these, some biosimilars that were approved last year in 2025 may not fully impact the market until this year. Which of those should we be watching?
We We've already talked a little bit about ustekinumab or Stelara. There are additional launches expected, and I would anticipate 2026 to mark more broader formulary shifts and utilization impacts, particularly with those private labels. We also saw a lot of the denosumab biosimilars launching. This will be the year of impact. All biosimilars for denosumab do carry interchangeability, and this does create fewer barriers to switching. So we'll see a lot of shifts in that denosumab space. And lastly, eculizumab or Soliris is the first biosimilar entry into the rare disease space. It demonstrates biosimilars are expanding beyond some of those traditional high volume categories that we're used to. So this is exciting to see this entrance into the rare disease space.
Heather, both you and Jeni mentioned regulations. Can you tell us what upcoming FDA guidance should we be paying attention to when it comes to biosimilars in particular?
There was an FDA guidance released late 2025 that focused on streamlining biosimilar development, reducing the reliance on comparative clinical efficacy studies, and hoping to reduce time and cost to bring biosimilar to market. This guidance created greater emphasis on analytical similarity and comparative analytical assessments.
So how does this guidance change the conversation around interchangeability?
I don't know that the guidance changes it, but it does enforce it. And we're really starting to move to the narrative and the hope that all biosimilars will be considered interchangeable and they'd be less of a special designation. The potential expectation is that biosimilars are interchangeable by default. Advanced analytics are viewed as more sensitive than clinical trials. And if finalized, hopefully this will bring more biosimilars to market with faster launches and less regulatory friction. What this does, though, is shifts the responsibility downstream to payers, health systems, and pharmacists managing those transitions and the education of biosimilar utilization.
Good to know. Taking all of this together, therapeutic insights, 2026 launches, and these regulatory changes, what's the biggest shift you're seeing in the biosimilar landscape?
What we're seeing is it's no longer a slow, cautious rollout. We are bringing biosimilars to market faster and there's more scale. And we're really seeing a lot of strategic steering by payers. Success is going to depend less on being first to market and more on formulary fit, channel alignment, and operational simplicity.
Heather, is there anything else you think we should know?
The most important thing to keep in mind is that not all biosimilars will behave the same or should be expected to behave the same. And strategy really needs to be molecule specific. What works for denosumab with broad interchangeability won't look the same as ustekinumab with private label steering, or even eculizumab or Soliris in the rare disease space. A one-size-fits-all biosimilar policy is becoming less effective as we grow over time in biosimilars.
Thanks, Heather. Jeni, is there anything else you think we should know about the SMO?
If I could leave listeners with one final thought, is that our projection is a helpful starting point, but we really encourage you to look at the top spend medications in your organization, identify strategic drivers such as site of care influences and specialty pharmacy growth, and understand how specific projections influence your own budget so that you can plan for this year and beyond.
And Jeni, where can our listeners go to get more information?
The Winter Spend Management Outlook is available on Vizient's new Spend Management Outlook Hub. We have our own dedicated webpage with the current edition, previous editions, and links out to other related resources. And you can find the link to our new Insights Hub in the show notes.
Thank you, Jeni and Heather, for joining us today to share your thoughts and insights and help us understand what to watch for in 2026. It's been great chatting with you both. Subscribe today. Like us. Send us your comments. We'd love to hear from you. Verified Rx is a prescription for success and is brought to you by the Vizient Center for Pharmacy Practice Excellence. Thanks for listening.